Now, here's another patient. This young lady is exhausted from excessive overtime at the cannery.
I am so tired, and it feels so good to sit down, even though it is in the dental chair. We've been working so hard lately at the cannery, and the production has been so great, and the foreman has been making us work more and more and more. And then, on top of this toothache had to start, and I think this is just about the end. Oh, what is that peculiar odor that I smell? Oh, I think that I wish that I was in a drier climate, something like Arizona, where I wouldn't have these attacks. I think that I'm just getting one of my old-fashioned, silly attacks again with on top of this toothache and with all the hard work.
No reference to asthma is shown on Miss Malone's medical history. Yet she mentioned her old-fashioned, silly attacks. In this case, diagnosis of asthma attack is suggested by the patient's labored breathing and her reference to previous attacks. Question 14. In Miss Malone's case, which treatment would you choose? A, administer oxygen, epinephrine IV. B, aspirate mucus, recline chair. C, administer carbon dioxide, or D, administer oxygen. D is the best answer. Oxygen probably would give Miss Malone sufficient relief. Removal of noxious odors should be accomplished as quickly as possible, too. In the event that oxygen should fail to give sufficient relief, then it would be necessary to administer epinephrine inhalant. Our next patient is a school teacher and quite active in community affairs. Keep in mind that no injection has been administered to Mr. Wellington.
We're been working up late at nights. We're working at the PTA. We're at the carnival trying to get things and booths and things set up and get things ready for this carnival we're going to have. Takes a little ivy, though, being up late at night and studying and getting the lessons prepared for the next day and getting sure that you're going to get things ready for the children. But I think it'll all be worth it to get this underway and get it going good. That's all we can do. Stay out there and so it smells sort of a little bit like sulfur around here. You think, I don't know, it's kind of a little hard to breathe with this smell. You think that you might be able to close that window a little bit. It's a little hard for me to breathe.
And now for question 15. How would you treat this patient? A, give epinephrine. B, give cough suppressant. C, either of the above, or D, neither of the above. The right choice in this case would be epinephrine, answer A. The patient was in great distress, a fairly serious attack of asthma. A bronchodilator such as epinephrine is probably needed to expand the lung air passages before oxygen therapy would be effective. The epinephrine mist is sprayed, permitting the patient to inhale the vapors. Inhalers may vary in the number of sprays required, so you should always check the instructions on your own equipment. Oxygen then can be given for added respiratory support, and respiratory irritants such as noxious odors should be removed. If the inhaler and oxygen therapy had not sufficiently relieved the patient, or if the attack had been even more severe at the onset, epinephrine IV would have been necessary. If the respiratory difficulty is not relieved, summon medical attention for your asthmatic patient as quickly as possible. Asthmatic patients should be scheduled in the morning if possible, and of course they should be protected from respiratory irritants. Asthma can be fatal. In a prolonged asthmatic attack, the bronchi can become plugged with mucus, resulting in asphyxiation. However, a fatality from an asthmatic attack is relatively rare. Here's the brief history of our next patient, Mr. Stark. Again, we should note that no anesthetic has been administered.
Had quite a day today. My roommate, he passed all his finals, and he had a little money in his pocket, and he felt like celebrating, so he decided he was going to take me out for lunch, and which he did. Went out to Seaways, and he ordered 2 big crab louis out there, and it was very, very tasty. Really enjoyed it very much. You ever been to Seaways? Real nice. It's real plush. Best looking waitresses out there in any place in town. The rugs are about 5 inches thick. And you topped it off with a crab louis. With a strawberry shortcake, I'm sorry. Something seems to be the matter here. I seem to be itching all over. Excuse me, Doctor. Doc, what's the matter with me? I'm just itching all over.
For question 16, what did the patient say? He, A, had been eating strawberries, B, felt dizzy, C, spent the morning at the beach, or D, was nervous about dental treatment. Answer A is correct. He said he had strawberry shortcake for dessert. And now question number 17. Which appeared first? A, red patches on the arms and hands, B, local itching, or C, nausea? B is correct. The young man first began scratching his arm, so his first symptom was local itching. As the reaction progressed, he developed generalized itching. In addition, you may have noticed the red patches beginning to appear on his arms and hands. Question 18. How would you treat this young man? A, sedative, B, epinephrine, C, both of the above, or D, neither of the above? Answer B is the proper procedure in a case of allergic reaction which has progressed as far as Mr. Stark's. The itching was quite widespread over his body, and the appearance of red patches on his skin indicated possible onset of more serious reactions. Epinephrine would be indicated at this stage. Preferably, it should be given intravenously, but a subcutaneous injection would probably take effect before more serious reactions could begin. The subcutaneous injection is given by pinching the skin between forefinger and thumb and inserting the needle just under the skin. Following this injection of epinephrine and dependent upon the condition of the patient, you may want to administer diphenhydramine, that is Benadryl, orally, intramuscularly, or intravenously. The probable cause of the young man's allergic response was the ingestion of an allergen, perhaps the strawberries he mentioned as topping off his meal, or maybe the crab. And now study this medical history excerpt. A block anesthesia has just been administered to Mr. Dudley.
Well, this construction work is really nice. The higher you get, the better it gets. Get up above all the confusion in the street. You don't have to look for stuff falling on you all the time. Hey, my whole lip's starting to feel funny, tingly. Upper and lower bowl starting to feel funny. Now, sometime you ought to come down and go on the job with us. Get up where you can see what's going on, rather than down all the confusion on the street level. Now my tongue's feeling that way, too. Oh, here in Oregon, when it's wet, sometimes the steel gets a little slippery and slick up there. We don't mind it. It's part of the day's work. Say, my whole throat now feels like my tongue's swelling in here. My whole throat's starting to, tongue's swelling up, and it's hard to swallow. I've never had anything like this before.
For question 19, which symptoms did Mr. Dudley have? A, swelling of tongue. B, difficulty in swallowing. C, swelling of throat. Or D, all of these. Answer D is correct. Mr. Dudley experienced all of the symptoms mentioned: a swelling of tongue, difficulty in swallowing, and a swelling of his throat. As you know, an immediate allergic reaction such as Mr. Dudley's is most likely to result in anaphylaxis, that is shock, if not treated immediately. For question 20, which would you administer if after an anesthetic injection there is a sudden swelling of the tongue? A, oral antihistamine. B, intravenous aminophylline. C, either of the above. Or D, neither of the above. Answer D. None of the treatments mentioned would be the correct choice. Intravenous epinephrine should be given first since the reaction was immediate and serious. The swelling of lips, tongue, and throat that Mr. Dudley experienced was angioneurotic edema, also called angioedema. Angioedema could be caused by an overdose of an anesthetic or by injection into a blood vessel, or the patient's sensitivity to the drug may be exhibited. The idiosyncratic reaction or allergy. It's not likely you'd give an overdose, but if you accidentally injected the anesthetic into a blood vessel, the result could be the same as giving an overdose. It is important to aspirate before injection and to measure dosages carefully, of course. You cannot prevent every case of angioedema with these precautions, but they will certainly help prevent the responses that can be caused by injection into blood vessels. Prevention of angioneurotic edema is highly desirable, for it might develop into allergic shock, which could induce tracheal obstruction or cardiac standstill. For question 21, which emergency actions would be required in tracheal obstruction or cardiac standstill? A, call a physician or hospital emergency service. B, perform emergency resuscitation. Or C, both of the above. C is correct. Both actions are necessary. In case of cardiac standstill, you and your staff should promptly begin mouth-to-mouth or airway-to-mouth resuscitation and closed chest cardiac compression. You and your staff should have special training in cardiopulmonary resuscitation. If a tracheal obstruction is present, preventing inflation of the patient's lungs, an immediate tracheotomy is necessary. You could use the transtracheal needle technique. For this, 1 or 2 13-gauge needles are inserted directly into the larynx through the skin of the neck, through the membrane between the thyroid and cricoid cartilages. You will probably have to administer oxygen using the face mask to support respiration through the needles. Only the presence of a physician can relieve you of these obligations to the patient.